Okay. Hello, my name is Ben Gallenson. I'm from California. I have a master's degree in clinical psychology, and I'm a doctoral candidate at Pepperdine University. My research focus is dissemination of optimal approaches for peer support on people with depressive disorders, although that's not what I want to talk about today. I also have extensive experience in substance abuse as well. And today I'm going to talk about recognizing the signs of drug abuse. Some of it's based in research, and a lot of it's based on, anecdotal experiences, and then also working with Ray and other people who have over 20 years of experience in working with substance abuse. And it's geared toward families in particular. So why do we care? So the prevalence of drug addiction in our society is pretty high. 19.7 million American people aged 12 and older battled a substance use disorder in 2017 alone. Drug abuse and addiction cost American society a lot of money, $740 billion annually, both in lost workplace productivity, healthcare expenses, and then also crime-related costs. 100 people die every day from drug overdoses, and this rate has tripled in the past 20 years. And that might be because of the opiate epidemic. So about 20 to 30 years ago, it was like crack. It was crack, and I think it was crystal meth, and it's a little bit harder to overdose. But what we're seeing is a lot of pills. People are mixing a lot of pills, both opiates with benzodiazepines, which are resulting in more overdoses, and then the heroin epidemic, which I think has been in the last 5 to 10 years. So definitely we're seeing a lot more overdoses. And over 5 million emergency room visits in 2011 were drug-related. 2.6 million people with addictions have a dependence on both alcohol and illicit drugs. So they're not necessarily mutually exclusive. 9.4 million people in 2011 reported driving under the influence of illicit drugs. So they're not just endangering themselves and their families, it's other people as well. 6.8 million people with an addiction also have a mental illness, and sometimes they're intercorrelated. So sometimes they might have a mental illness that precipitates the onset of the substance abuse, or substance abuse can actually impact somebody developing a mental illness as well. Rates of illicit drug use is highest among those ages 18 to 25 actually. Which is kind of why I'm talking specifically about young people and adolescents. And I think if we target that age population really, really early, we can make a big impact in preventing someone of having lifelong addiction. And then here's the statistics that's actually really mind-blowing. So over 90% of those with an addiction began drinking, smoking, or using illicit drugs before the age of 18. So catching it early and being able to recognize the symptoms of substance abuse that's kind of the crux of what we're trying to do. So how do I know whether my loved one is on drugs? And it's funny because there's not necessarily research based on this, but just based on our own experience, you know them better than anyone else. So if you're a parent, you know that there are significant behavioral changes that happen that's different than how your kid normally is. And it's funny because there's a process of denial that a lot of parents go through because they don't want to accept that their kid might actually be on drugs. It could be for a variety of different reasons, but what we want parents to do is really look at what they do know, not necessarily what they don't know. So a lot of times parents will focus on things that they don't know as a basis to kind of disconfirm what they suspect to be true. And so part of this is denial, and it's usually extremely strong when parents first start noticing these behavioral changes in their kids. And sometimes it's driven by guilt and maybe a past reflection onto all the ways that you might have failed your child. And then other times parents might find it hard to believe their kid is on drugs because they raised them well and they taught them things like morals and values and character. But what we're finding is there's a lot of different reasons why somebody might become addicted to drugs or even experiment with drugs. And this includes also peer pressure, bullying, past trauma, and then also previous mental illness diagnosis. So things like depression or even ADHD. And it's interesting because they find a prediction of ADHD diagnosed in childhood with later substance use. And a lot of parents freak out because they think if they gave their child stimulant medication that is what contributed to the substance use. And it actually has more to do with probably the aspects of ADHD that are involved in like impulse control and being able to self-regulate, that has more to do with them developing addiction than you actually giving them stimulant medication. That being said, nobody who's addicted to drugs who have ADHD, whether you're a kid or adult, should be using any kind of amphetamine or stimulant medication. Other things to kind of consider is for anyone, not even somebody with ADHD, but the adolescent or young adult brain has not stopped developing, usually until the age about 25. So there's parts involved that have to do with impulse control in the prefrontal cortex that make it really difficult to refrain from like experimenting. And that's why you see like a lot of young people who might engage in like reckless driving, or they might engage in certain behaviors that are a little bit more risky, and they have poor decision-making skills. And for males, it goes all the way until about 25 when their brain stops developing, and then for females, I think it's about 22 or 23. But I think recent evidence is actually showing it's even later, maybe even 28 to 30. And so this can become a problem. So if you have a young person whose brain has not stopped developing yet, and they're taking drugs, it can actually rewire the brain and create new connections and pathways through repeated use that are potentially lifelong and permanent. They find that if you're an adolescent and you smoke marijuana, it actually, in copious amounts, it can actually reduce your IQ lifelong, and it actually has impacts as far as having like cognitive deficits or thinking problems, and it increases your risk of psychosis as well. So again, that's kind of a good reason to do early intervention. I don't know if they've been able to replicate the study, because obviously it was a longitudinal one. It happened over a long period of time. But they did find that those that did smoke a lot of marijuana in their youth did end up having lower IQ and having these cognitive deficits. Other changes that occur is that when you're young and you're using drugs, and you might use them if you have a mental illness or you have depression or anxiety, it can exacerbate it, but then you also develop kind of these unhealthy coping patterns. So whenever you experience uncomfortable emotions and you reach for a drug and it causes euphoria, it kind of becomes this kind of adaptive coping skill. Well, it's not adaptive, it's unhealthy. And those can also impact and rewire the brain, lifelong. So it kind of makes sense, why addiction is so difficult to treat, because that's kind of what we're up against, the neurobiology aspect of it. So this presentation, like I said, is geared to helping you look for what you already know as a parent and suggest things that you can do to help your loved one before it's too late. So involvement. So making a commitment to help. I guess this is kind of a given, but often parents don't always want to get involved, especially once their kid reaches adolescence. They kind of will rationalize or think, their kid is growing up, they're independent, and they don't always want to get involved in the way that they should be. And I think part of it also is this feeling like they don't want to be that parent that's overbearing or interruptive or too intrusive in their personal life. Especially in the last generation, there's been a lot of like helicopter parenting that they've shown is not really conducive to somebody's development. But if you suspect your kid's on drugs, they actually do propose that parental monitoring is really, really helpful in reducing use, as well as binge drinking as well. So it's like some things that go through parents' minds is, they're a teenager, they're moody, boys will be boys, or teenagers these days, and they use that as a basis to overlook like serious red flags. I think the other aspect, and of course we learn that in treatment, is being willing to confront. And I think parents have a hard time with that as well. And also really dealing with the fact that their kid might be totally lying to them. And they never had prior, they never had problems in that area with them. And so they really want to believe them, but the facts don't add up. And so being willing to really confront your kid on that level and the incongruence based on what they're saying and their behavior will be really important. And then overreacting versus acting passively. And it's so funny because when there's so many red flags, parents are so worried about getting it wrong, right? So maybe they have certain facts wrong and they're confronting and their kid gets mad at them and reacts. And we believe it's better to overreact than act passively, especially when we're talking about addiction. So research shows actually that parental and child interactions and communication are a huge buffer against substance abuse. And even once they are addicted, if they are addicted, it can actually lower use. So research shows that greater frequency and quality of general parent-child communication are negatively associated with adolescent substance use. And then also prevention efforts aimed at getting parents to talk with their young adolescents are often guided by the primary socialization theory. And this asserts that parents can influence their children's substance use perceptions and behaviors through communication. So we believe the earliest that you communicate with your child and talk openly about these issues can make a huge impact on their substance use perceptions and behaviors. And this is regardless of things like peer pressure. Obviously there's things like temperament that might cause them to experiment, but as a parent you actually have a huge influence. There's also considerable evidence that suggests parent-adolescent communication can effectively buffer the risks of early use initiation, and then also reduce binge drinking as well. And this is by shaping youth anti-substance use attitudes, norms, intentions, and behaviors. So many teenagers and young people believe that no one, and this is kind of common, even among people who don't suffer from mental illness or substance abuse, that this kind of feeling of uniqueness and that nobody understands them. And it can be exacerbated also if they do have a mental illness. And when a parent does not act on their child's behalf or get involved, it solidifies what the child already believes to be true. And although they desperately want help or to find someone who understands, it's difficult for them to find someone. And so if you have a parent that's disengaged or not involved or not showing that they care in that kind of way, it can really impact whether they do use drugs or consistently use drugs, or whether they can get sober or not. So communication is a really, really, really big key. Also attitude, so your attitude as a parent. So research on more specific cognitions also highlights the importance of parent thinking on child outcomes. So as an example, parents look for reasons for both why they and their children act the way that they do, and they call that attributions. And they can make parenting more efficient only when they're accurate. So it can also interfere with effective parenting when it leads to feelings of anger or depression. So you might attribute your child's bad behavior as a poor reflection on you, or something like they have a bad disposition or they're a bad seed, or you did something or are an inadequate parent, or they did something that intentionally tries to hurt other people. And these negative feelings can really distract parents from the task of parenting and make it more difficult for them to react appropriately, especially within a substance abuse or kind of a mental health problem. Adolescents' misuse of alcohol and other substances have been found to be strongly related to perceptions of parental attitudes towards substance use. So parents should be looking at, what are their individual attitudes about substance abuse? What was it like for them growing up? Where do they stand on key issues? These things can actually really impact how your child views substance abuse, regardless of what goes on at school. Studies indicate that increased parental monitoring, so this is knowing where your kid is, who they're hanging out with, what kind of grades are they getting, are they involved in community activities, is actually linked to a decrease in young people's alcohol misuse. And this is huge. This has actually been replicated, and there's been a lot of studies on this. So increased parental monitoring can lower young people's alcohol misuse and drug misuse. So as a parent, you want to ask yourself certain questions. And this is even if you don't suspect that your child has a substance abuse problem. Do you tend to avoid facing unpleasant facts about any area of your life? Do you think it's possible that your child might have a problem even though you did all the things right in raising him or her? Do you actually need proof before you take action, or are you willing to act on intuition? And are you afraid to ask your child if anything is going on, or address kind of those heavier issues? Have you shut yourself off to your child even though you know something might be wrong? Are you waiting for something to change? And if your child has a drug or alcohol problem, are you willing to make a commitment to find the solution? So some of this is anecdotal. They find that a lot of interventions that are geared toward helping young people with the parental involvement involve some of these things. So trusting intuition, and it's hard to measure that through research. They actually have done it. People who have less experience about like a certain subject matter, who rely more on intuition, actually have better outcomes when it relates to something that they have intermediate knowledge about. So sometimes intuition, especially if a parent doesn't know that much about substance abuse, if you rely on intuition, it's actually more effective than like deliberating or thinking about it, or rationalizing certain red flags. Also getting involved, which we've already talked about, checking in with your child every day, having dinner. There's been a lot of research on having family dinners each night. Establishing rules and boundaries, which we learn after they come into treatment, and be willing to talk about things that are uncomfortable, so things like sex and drugs. Confronting, which we already talked about. You want to address personality and mood changes and watch carefully for how they respond. Generally, if there is substance abuse going on, there is a lot of lying and rationalizing that goes on, and you really want to be willing to confront and not let your fear of not being liked in the way of helping your child. And then some suggestions have been, like, if they do react or they get angry, to let them cool off for an hour, but always revisit it. So be honest. So you want to be genuine and avoid sounding like behavioral changes are a big inconvenience to you or it's disrupting the family. You want to establish a line of communication by discussing how you and your child have not really been able to talk until now. You also want to avoid projecting. So a lot of times family, and I see this all the time when I worked in substance abuse, was that families kind of had their own agenda and they had something in their mind of what they wanted their kid to be, like, finish school, and be quote unquote normal. And it was really hard for them to accept the fact that their kid was struggling and they had an addiction. And some of it has to do with their own personal values and what they wanted for their child that didn't kind of live up to it. But it also has to do with like the community and like what people think and like hiding the substance abuse. So you want to like put your own feelings or assess your own feelings and put that in check, because that will impact your child as well. You want to listen, understand, and accept them, which can be kind of tricky, right? Because you're also trying to establish boundaries. So you want to really listen carefully to what your child's telling you, and there's a lot of valuable information embedded in the reasons why they use drugs, and actually maintain their behavior. So there's certain things in their environment that can maintain the behavior. So school, certain friends that they hang out with, jobs that they have. And it'll be extremely important later when they actually, when you help them decide to go to treatment and they're resistant. So knowing what's going on in their environment that's causing them not to actually go into treatment. And you also want to keep in mind the mind of somebody, a young person. So usually, in my experience, a lot of teenagers or young people are really afraid of what people think of them. And many of them are still formulating an identity. So having a substance abuse problem and needing rehab can be a very shameful experience, which will cause them to be resistant. That's part of the reason, why they're resistant to go to treatment. And so it might take time for them to get comfortable with like a sober identity and meeting people their own age that they relate with, that are sober and moving on with their lives. And also taking actions, increasing self-esteem through taking responsibility for themselves and their lives, make an impact on them getting comfortable with the sober identity. So you want to validate their experiences and normalize feelings, but you don't want to validate the invalids, such as maladaptive behavior or certain distorted thinking. And you want to gently confront the incongruence in what they're saying in their behavior to help them start to recognize that the way they're thinking or viewing things and behaving is off. And you want to accept your child also and the problem. So it's really going to be difficult to get your child help if you are not accepting the problem either. So that's just some key points in kind of helping a parent navigate the beginnings of what might be an addiction with their kid. So we have this 10-day worksheet that Larry's mentor, actually, Perry, had created. It's a 10-day worksheet to assess whether your kid might be using drugs. And it kind of helps you organize the information, but it also kind of helps you get a feel for how bad it is. So frequency, duration, and the severity of the addiction. So you want to have, there's a little part for the date. There's a little part for you to type in what's tangible, what you actually see, what you might find in their room or their car, any drugs or alcohol. There's paraphernalia that's related to the drugs and alcohol. They may not actually be the drug, but it's something that suggests they might use drugs, and I'll go through it with you. And then also certain behaviors that are off. And then any additional notes or observations that you make that might not be related to alcohol or paraphernalia or behavior. So we'll talk a little bit about prescription medication. We have opioids, which are increasingly popular. I think they had like a crackdown like in certain states or certain areas where there was a lot of like doctor shopping and pill mills. And so now we're seeing an increase in heroin use, but pills are still common and they're not that hard to get. And kids can be pretty crafty. They can look in medicine cabinets when they go to other places. They can also buy these things off the street. So opioids treat pain. Examples are things like oxycodone, which consists of OxyContin and Percocet, and then also hydrocodone, such as Norco. And then they have like medication-assisted type medications to help people who do become physically dependent on it. So Suboxone, methadone, and Subutex. Generally, that's in the context of heroin, generally. But those are also abusable and pretty easy to get, depending on where you are. There's also anti-anxiety medications and sedatives, so Xanax, Valium, that was kind of very common in, I think, the 50s, 60s, 70s. And then other hypnotics, which are more recent, so things like Ambien. They help both anxiety and sleep disorders. And then you also have stimulant medication. So this is what I was talking about before, ADHD medication. So Ritalin, Concerta, Adderall, Dexedrine. I don't know if that's as common. Maybe that's, I think it was more of an older drug. But that treats attention deficit hyperactivity disorder and then other sleep disorders as well. And actually, the culture in college, a lot of young people tend to use this, even though they might not be diagnosed with ADHD, because it helps them study. And it helps them stay up all night too. So common medications. Now these, I feel like a lot of families don't know about. There's actually common over-the-counter medications and supplements that they can just buy online that are addictive and that will get you high and that actually are more readily accessible than any of the other drugs that I'll talk about. But cough medicine, so DXM, can, if you take enough of it, and it usually takes, a lot of times they like the high blood pressure kind, the quercetin that you get. I don't know, some states actually lock it away, and so they kind of monitor if anybody is like buying a whole bunch. I know they do that for Sudafed, because I think they use that to make methamphetamine. It might be a variation of that. But it causes things like dissociative experiences if you take enough, euphoria, and then other cold medicines, like I mentioned, Sudafed, that causes more stimulation. Motion sickness pills, so things like Dramamine can get you high. They're finding that Imodium, if you take enough of it, can cause an opiate-like high. And so a lot of people will also use it to come down or to ease withdrawal symptoms for opiate medication. And then other random ones that you can just like buy online. There's like no regulation. If you go down the street to like Don's Market or whatever, they have it, like all kinds of kratom, which can cause in enough doses like an opiate-like high, euphoria. Phenibut and kava activate GABA receptors in the brain, causing relaxation. That's kind of akin to like anti-anxiety medication, like we talked about, like Xanax and Valium, and also alcohol. And then bath salts, which I don't really hear too much about that anymore, but I think it was popular like 5 to 10 years ago. And that's kind of stimulating. It can cause hallucinations. People become very aggressive on it. You can hear some really crazy stories about what happens to people. So alcohol. So you want to look for water bottles, thermoses, or canisters in the car, in their room. You want to sniff it. Don't just assume. If you suspect, if there's all these behaviors and your child's out all night, you just might want to smell what's in those water bottles. Also, if you have alcohol at home, if you suspect they have a substance abuse problem, I would not have alcohol in the home anymore. But you want to check levels of alcohol in the house and use a marker to track the alcohol that they take potentially. Marijuana, so this is just common kind of paraphernalia that goes along with the drug. So rolling papers, they look like this. They can also put marijuana in cigars to make a blunt, which is a little bit bigger. There's pipes, so they kind of look like this. There's metal, there's wooden, there's acrylic, there's glass stone, there's plastic and ceramic. And then bongs, which is a filtration device to smoke marijuana, and then roach clips. So when they have like a marijuana cigarette and it gets down to the end, they don't want to burn their fingers, they can use this little roach clip. And then also e-cigarettes, which is hard because you never know if there's nicotine in there or not. And then also I think nowadays, like the vapor that comes from those, you can't really tell if it's marijuana or if it's nicotine, and they can do it in open spaces and no one knows. So again, if you find anything like this paraphernalia, you want to look at like a constellation of other kinds of behaviors too, which is why you're doing that 10-day worksheet. So heroin, it looks like this on the East Coast. On the West Coast, it's black tar. There's needles involved if they're shooting it. I think you could snort it, and then you can also smoke it, like if it's tar. Tin foil, that's another piece of paraphernalia. They put the tar on here and then light it up, and then smoke comes out, and then they inhale it using like a straw that's similar to that. Plastic pen case or a cut up drinking straw or a rolled up dollar bill, and then also a small spoon, so they can actually cook it in the spoon and then inject it using a needle. Cocaine and methamphetamine, crystal meth looks like that. Those baggies are very common. Pipes look like this to smoke stimulants. Small mirrors, small spoons, short plastic straws, rolled up paper tubes, razor blades. That's kind of a red flag anyway, because they could also be cutting themselves, which they might have like their sleeves rolled up or rolled down, like even in warm weather, and that could be because they're cutting themselves, or they're having like intravenous marks on their arm from shooting heroin or crystal meth, or both. Sometimes they speedball it. And then also lighters. So if your child doesn't smoke cigarettes, like why do they have lighters in their room? Other kind of red flags are like things like candles and incense that they might have in their room that they randomly one day all of a sudden start using. This is less common, I think, in rural areas. I was talking to somebody about this. It's more common in cities, I think, and I think it was more common like in my day, like in the 90s and like early 2000s. I don't know how many kids actually go to raves anymore, but there's certain things that go along with going to a rave that are suggestive that person might be engaging in drug use, things like MDMA, which look like this. These are a little bit more dangerous because they're, heroin and crystal are too, but they're not regulated in any kind of capacity. They're pills that are not like prescribed by doctors or anything. So glow sticks, surgical masks, I think is more for inhaling, like chemicals, like paint to get high. And then pacifiers and lollipops to prevent teeth grinding and jaw clenching that might come with MDMA use, and they also might cut the pill with like heroin and crystal meth that cause that. Actually stimulant mainly, so probably meth or coke for teeth grinding and jaw clenching. And then bags of candy to hide pills. So if you're noticing a lot of like kind of these things hanging around, they might be sticking pills in them, MDMA or other kind of pills that they buy off the street. And then inhalants. And so the easiest way to look at this is see what you have in your garage, and if things are moved around or things are missing, be cognizant of that. But people can huff paint and actually get euphoria, get high from it. So some paraphernalia would be rags for sniffing, tubes of glue, balloons. On the West Coast, they actually use that to put heroin into. So if you find any balloons in a room, I think it's a red flag. Bottles or aerosol cans with hardened glue, sprays, paints, or chemical odors. It looks like that. I think people also use what do you call it? Whipped cream, like whipped cream canisters, and they get high that way. So items used to cover up drug use, so mouthwash, mints, and breath sprays can cover the smell or mask the smell of alcohol, but if you're drinking enough for a long period of time, it's really coming out of your pores, so I don't know how effective that is. You got eye drops for bloodshot eyes. You get bloodshot eyes from smoking marijuana, I think crystal meth too. Sunglasses for red eyes, changes in pupil size or eye movements. I don't really talk about like things like hallucinogens. There's like shrooms and things like that, which can cause like your pupils to get really big. So if they're wearing like sunglasses indoors, that kind of thing, they might not just be a moody teenager, it might be drug use. So certain behaviors to look out for, aside from any kind of personality changes, and I know an increase in mental health symptoms too, so anxiety, depression, and you might actually confront them or talk to them about it. So like a good example would be like somebody comes, like your kid comes home from school, he's got red eyes, he's slurring his words, he goes right upstairs and goes to sleep. And then you ask him about it the next day and he says he broke up with his girlfriend. So the red eyes might be attributed to crying, and then going to sleep early might be due to like sadness or depression. But what about the slurred speech? And so you want to address that aspect of it and confront that. So a lot of times parents will things won't check out and they won't confront on these specific behaviors. So eye contact or lack of it, bloodshot eyes or dilated pupils, slurring of the speech, which I talked about, an increase in paranoia from stimulant medication, that's common, losing things, changing their eating habits, extreme weight loss or weight gain. They might gain a bunch of weight if they're smoking a lot of pot. They might lose a lot of weight if you ingest stimulant medication because you're not eating. Defensiveness, that's a big one too. Missing property or missing money, personal from yourself. They might steal from you. Personal appearance, going in and out of rooms, spending a lot of time at home alone. Their school grades might fluctuate. Violence or anger, poor memory, withdrawn. They keep conversations very brief with you. They're always in a hurry. They're up until late hours of the night. Short attention span, coming home late, leaving early, avoiding encounters with families altogether, using excuse of not feeling well, and you're bugging me. So it's interesting because some of these might be characteristic of like somebody in their adolescence, not necessarily substance abuse, which the parent 10-day worksheet can kind of help you really determine that. So there's several kind of constellation of behaviors that will be suggestive of somebody using drug abuse. And so that's kind of what that worksheet's for, is to help you kind of see the big picture over a longer period of time, instead of just writing off each of the behavior as kind of like a characteristic of like moodiness or just being a teenager. So certain hiding places, which has kind of changed over the years since I was a kid. So backyards and garages, underneath dressers, oftentimes they'll stick paraphernalia or alcohol or drugs like on the floor underneath the lowest drawer. If you just take the drawer completely out, it's a good hiding place. Behind bookcases and in books, desk drawers, under beds and mattresses, jewelry boxes, coat pockets and coats in the closet, taped underneath the tables, in drawers underneath the clothes, in instrument cases, places where you never go anymore. It might be like puzzle boxes or toys from their childhood. Trunk of the car, the glove box or the console of a car, underneath the carpet, under seat of car, in wallets or purses, in gym bags and thermoses. Inside puzzles and game boxes, inside air conditioning units, behind pictures, along frames, inside closets, also in film canisters, although that was like in my day, but people usually just use their phones for pictures, so I don't know if there's any film canisters circulating out. That's uncommon. Whoops. So just to kind of recap on some things to remember as you go through this process. So remember to ask how their day was, know where they're going. Parental monitoring is highly effective in reducing substance use. Talk and communicate with other people in their lives. So teachers are very observant. They know who they're hanging out with at school and who's engaged in drug use and certain behavior and who's not. Friends, sometimes if you talk to a close childhood friend, they'll tell you the truth, especially if it's gotten really bad and they're worried about them. Definitely try to avoid like you're feeling like you're interfering, and be careful not to judge. Avoid taking their behavior personally. So when you do confront them, they might have a very severe reaction. They might get very angry. They might call you names. They might bring up stuff from the past. They might blame you, and you don't want to take it personally that they are on drugs. So that's what's causing a lot of their reaction. And they also don't want to give up what they might think in their minds is working for them. Let them know you're going to be more involved in helping them, and actually show them. So if you're establishing family dinners each night, if you're checking in with them every day, you've got to be consistent in making that happen. Show them you're serious and committed. Keep using that 10-day worksheet past the 10 days so you can stay on it. If you're utilizing drug testing or anything like that, you're still going to want to monitor behaviors and look for anything. And also, if you are drug testing, make sure that you are with the drug test the whole time. So oftentimes, because unsuspecting parents will have their kid take a drug test, and they'll leave like the urine just sitting on the counter, and the kid will come back and tamper with it or put water in it or use someone else's urine. Show them you're serious and committed. I already said that. Avoid confronting them when they're super hostile. If they're really hostile, let them cool off for a period and then revisit. And wait until they've settled down before talking to them. You don't want to engage with them in this attacking type dynamic, attack withdrawal or attack dynamic. Realize that their home environment really shapes their belief systems. So it's really important to really self-assess and know kind of where you stand on substance use and how you might be engaging in denial, because a lot of what you do will maintain that behavior, especially if they're living with you or you're giving them money if they're a little bit older, past the age of 18. Peer support groups, so things like Al-Anon are really effective in providing you with like other people who you can identify with, but they also have a program of recovery that can help you kind of identify the ways in which you might be maintaining the addiction. And then also get over feeling like I said before, I already said that up there, but I'm saying it again. Get over feeling like you should not be interfering. So treatment options, so 12-step programs are kind of what we know, what helps a lot of people who have serious addiction and alcoholism. So it's kind of like Al-Anon in the sense that it provides a lot of peer support for the person who's addicted, but then there's also a program of recovery that helps that person change and learn how to live their life sober. And it's also a spiritual program as well, so not any kind of religious, or it's not affiliated with any religious kind of organization, but it helps, has helped a lot of people. And sometimes it's used as an adjunct to things like inpatient programs or partial hospitalization programs or intensive outpatient programs. So inpatient programs is kind of around-the-clock care. There's nursing available. I think in a lot of places you might see the doctor every day who might put you on medication. You're also involved in like intensive therapy, and you're living in there for about 30 to 45 days. A lot of times insurance companies might pay for it. Sometimes it's out of pocket. Partial hospitalization programs is where you live at home and then you go for 5 days a week for several hours during the day to receive therapeutic services. There might be medication-assisted therapy, and there might also be drug testing as well. And then IOP is kind of a step down from that, intensive outpatient programs, and that might be 3 days a week for a little bit less time. And they offer therapy as well as medication-assisted. And usually it's kind of like a step-down process. Sometimes it's not. Then there's recovery homes and sober living homes, which will kind of change throughout the year. Some are very structured, some are not so structured. But it's a live-in facility that you go in, and you might have a little bit more freedom and flexibility, and there's not as much therapy involved as like inpatient programs. It really depends on like where you go. But that will provide like a space for you to live more in the long term. And some of them are transitional, so you might be able to get a job and start working and move out or go back to school while you're there. And then medication-assisted programs, it's a big source of controversy. So a lot of times, I think people in the substance abuse field who are very involved in 12-step programs and can see the effectiveness are kind of against things like Suboxone or methadone. I don't know why people are taking that anymore, but Suboxone and Subutex can actually really like save a lot of lives in certain contexts, and it can be damage control. and it can help a lot of people not like totally overdose and die. That being said, I think there's a select people, sometimes with mental illness, but they might be polysubstance abusers who will go on Suboxone and then they start smoking crack, or they start, injecting methamphetamine, or they just start drinking more. So it really depends, I think, on the person. And then there's some people who just get addicted to pain pills, and then they go on Suboxone and they're completely cool. They're not using other substances. So it's really important to be able to assess for each individual person, that. And what else can I say about treatment options? And that's it. Yeah, that's it. That was kind of an abrupt ending, but no references. So, anybody have any questions? Do you want to talk? You have a question, or are you going to talk? Ask me something.
Thank you very much. I went back to questions to ask yourself as a parent. Mm-hmm. And I work in a treatment center, and I've seen a lot of things for the last 29 years, but a lot of the behaviors that you're telling a parent in the presentation that they need to look at within themselves, we see in treatment when they come in. They still suffer from these same behaviors, even though their loved one is clean and sober, and in treatment they still face struggles with getting involved. Mm-hmm. What do you have to say about that?
So parents still have trouble getting involved?
Yes, they still suffer from the same traits that they do when their son or daughter is on drugs.
Right.
Like avoiding facing unpleasant facts.
Right. Yeah, so it kind of goes back to what I was talking about. So certain family dynamics will shape, environment dynamic, things in their environment are shaping your kids' kind of perception or behavior. And so we do think, and this is kind of an old school belief, but it's still very prevalent, that families have a big part in kind of maintaining somebody's addiction, whether it's through enabling type behaviors. But oftentimes we do see a lot of parents come in who don't recognize that they're part of the problem. Like they cannot see. It's almost as bad as if it's the addict themselves, not able to recognize that they're addicted to substances. It's almost as bad as that. And sometimes it can be even more difficult because they aren't the identifiable problem. It's really the addict. So getting them to see that is really a challenge. The research shows that family therapy is actually really effective in helping families kind of overcome those behaviors, and then also helping the addict eventually get sober. But you're right, it's very difficult, and parents still engage in that. I really suggest that they go to Al-Anon and they are involved, just like what I was talking about getting involved in your child's, or identifying that your child has a problem. You want to get involved in the same way and be part of the solution. And so oftentimes when we're treating somebody with addiction, there's a lot of therapy that's involved, but then there's a lot of providing direction and suggestions for that person who's addicted to take in order for them to stay sober. So and I was talking about rewiring the brain, a lot of what they do, unbeknownst to them, always leads them back to the drugs and alcohol. And so providing direction and providing structure is really effective in getting them to start taking different actions, and it can actually rewire the brain and create new habits. But the same will also be for the family as well. So the families are just as unaware as the addict are that they're engaging in these behaviors too. And although they're well-meaning and well-intentioned, they're actually contributing to the problem in a lot of ways. And sometimes even parents are really used to that kind of dynamic. They might have grown up that way. They might have used kind of enabling or people-pleasing or enabling as a coping mechanism in their household. And so it's really therapy should involve getting that person to really be able to self-reflect and look at how they've been using, that kind of coping skill, and it's been actually affecting other people, not just themselves, in their entire family as well. So I don't know if that answers your question, but definitely those behaviors are still going on. And it's actually interesting too, when we're talking about behaviors, also with the person who is addicted, some of what they do when they're under the influence, they actually do in sobriety. So there's still kind of moodiness, there's certain behaviors that they engage in that they did for a long time when they were using. That is difficult for them to kind of get over. And it becomes really challenging too, because they don't have the drugs and alcohol anymore to cope. So it's really hard to kind of face reality, and not only are you facing reality and addressing problems in your life, but you also have to change, in these really big ways. The good thing about like early treatment and getting somebody involved, like a kid, like in therapy and doing early prevention, is that kids are really malleable. So the younger that they are, the actually more influence they are to change. So putting them in like a structured environment can really help in ways of rewiring that brain. But then also it really teaches them good lifelong habits, as opposed to somebody who's in their 40s and 50s and 60s and getting sober, and they can't hear what you're saying, or they don't want to engage in treatment and they're very set in their ways. It can be kind of more challenging. So if you are a parent and you're struggling and worried about where to send your kid, or sending them to rehab or treatment, and sometimes parents get worried because they'll be exposed to other people who will teach them, other ways to use drugs, I would really rethink that and understand that treatment, early prevention and early treatment can really, really help them, like lifelong, really change those behaviors and change. So.
I have a question.
Yeah.
It seems like a lot of parents want to put their kid on lockdown.
Mm-hmm.
They take away their phone. They're not allowed to go anywhere.
Mm-hmm.
If they go anywhere, the parent takes them, brings them home, put them in a lockdown situation,
Mm-hmm.
only to find for them to run away or something.
Mm-hmm.
So could you explain a little further about what you mean by structured environment?
Yeah. So, when you said that, I was thinking about like the parent who's like putting their kid on lockdown at home versus like in treatment. I think a lot of those skills that we try and teach parents is to have like an open and honest conversation and to be involved in their kid's life, but not in a way that's going to be like punishing or punitive. So you want to like reinforce honesty and establish trust between you two. Because often what we find is like kids who are using drugs or they're severely addicted, they actually do want help. And like I said before, like they might not even be aware of that. But if that parent can open the door for communication and establish a line of trust and know that there's not going to be like these severe consequences, but there'll be, boundaries that are appropriate, you have a better chance of helping your kid and not having them run off. And within the context of like a rehab or a structured environment, it kind of, comes with the territory. So generally what we really suggest for parents to do, even while their kid is in treatment, is to close the door. That's what we call it in some ways, or establish kind of healthy boundaries. So don't bail them out and really let them feel the consequences of their own behavior. So even without the context of substance abuse, there's a lot of like behaviorism or behavioral therapy that can be really helpful. And kids are not really, or young people or anybody who's addicted or human beings in general, are really not going to change unless there's enough consequences in their environment to get them to do so and to stop engaging in their behavior. So oftentimes, obviously, drug use is reinforcing. There's a lot of pleasure associated with that. But if there are a lot of consequences to it that are big enough, such as like being homeless, not having money, and the parents on board and they're recognizing, that they're enabling their kid and they stop doing that, then that kid will return to treatment or will stop engaging in those kind of behaviors that you're talking about, like being defiant or running off or not taking it seriously. So again, it kind of goes back to, you know, family dynamics and parents really taking a look at what they're doing and being willing to change and look at themselves and how they're contributing to the problem. And in fact, it can really make or break that person getting sober. Like, people don't realize, but oftentimes it really has a huge impact on their kid eventually getting sober and changing their life. So, but.
Oh, I have a question. I have two questions, Ben.
Yeah.
Thank you.
Uh-huh.
So what I'm seeing in family sessions and in therapy
Mm-hmm.
are enmeshed parents, where we've got the ones that are locking down, but
Mm-hmm.
even though they're here,
Mhm.
if the loved one is in rehab, they want to be in every aspect of it, even in treatment.
Mm-hmm.
And then when we, so quote unquote, pull the covers or confront the parents about the communication and the dynamics that have been toxic
Mm-hmm.
with their child,
Mm-hmm.
they tend to run.
Yeah.
So, is there a specific approach you would use, or do you have any tips?
Yeah. I definitely would, I think, like a type of like psychoeducation or providing families with an education on family dynamics and how they contribute to addiction might help normalize it for the parents. Oftentimes they come in and they might be feeling guilt or feeling as though, due to something that's happened in the past, that's why their kid is the way that they are. And so there's this excessive need to like make up for it and then not recognize that they had made a mistake. So I think providing like a psychoeducation and normalizing it, you know, within the context of all families, you know, with addicted loved ones, will do a lot to help them be more open and willing to listen to what you have to say. That being said, sometimes families have to go through the process one more time in order for them to kind of realize that, you know, they might be part of the problem. So oftentimes, and there's no research to support this, but I guess this is more of like experience, like sometimes you do what you can to plant the seed, and then later when you've already predicted the same outcome for them, you know, they go home, the kid comes home, he eventually relapses, you know, and they're back into that interactional pattern that's causing the problem. They'll remember, you know, what you had said, and then they might come back and be willing and more open to listen to what you have to say. I do think that like establishing rapport and it's really important in the beginning. You know, I don't think you should go in there right away and start calling out, you know, parents on, you know, what they're doing. And but I do think it's certain situations, especially families who are also stubborn and they're not listening and they've already been through several treatment centers, even though it's been pointed out to them, sometimes that kind of abrasive feedback is really necessary. So I think it really depends on the family and the person, you know, that we're dealing with. Oftentimes, and this is kind of not always the case, but sometimes, I should say, that parents of addicted people sometimes don't change. And so if you can reach the person who is addicted in whatever capacity you can, and sometimes that's through education, it's through time spent with them, it's through identification with other people who are also addicted, can actually be enough to change. So even if the parent is still engaging in that kind of enabling or enmeshment type behavior, the kid might be able to change on his own. I don't think that's always the exception. I think there's variation if that's possible, but I've seen it. We've seen it happen, you know, several times. So
I'm actually seeing it now.
Oh, you are?
Yes.
Yeah.
And so I was curious as to just the degree. It's insane, the level of enmeshment and the control, of the parents. Where it's almost accusatory. Their involvement is just very maladaptive and negative.
Yeah.
And so I just wanted to pick your brain about that one.
Yeah, absolutely.
Second question. We were talking about ADHD, ADD, things of that nature, and how the prefrontal cortex kind of that risk-taking behavior. And I'm seeing that more now prevalent as I'm working here and working with clients. And is it the relationship through the addiction that says, well, I'll never have that euphoric high without the drug? Is it because they base their relationship on that, their dependency on it?
Yeah, so I mean, there's a huge neurobiological component that's involved in addiction, and if you've been using substances for a long time, you know, it activates certain receptors in the brain that without it, there's going to be like a long, they call it PAWS, or post-acute withdrawal syndrome. There'll be a long period of time in which what's reinforcing in the environment is not going to produce, you know, the levels of dopamine that they need to feel happy or to get pleasure from anything in their environment anymore. And sometimes, like if they've been using downers, like the GABA receptors in the brain are like depleted, and without the alcohol or substances, to kind of initiate more of it, more levels in their brain, there might be like a lot of anxiety or kind of odd thinking, or like panic attacks, things like that. So it might take time for the brain to adjust and to get pleasure from the environment again, and to have healthy levels in their brain, like neurochemically, to be more balanced emotionally. As far as ADHD goes, I mean, they say that there is adult ADHD, but as far as like impulse control and decision making, that gets better as you age, and actually neuroticism too. So sometimes it's all about like taking somebody who might have an impulse control problem or ADHD, putting them in a structured environment, eliciting peer support, getting them sober, and engaging in new behaviors to be able to help them to rewire the brain, and put them in a safe place until they can actually be more adjusted, I guess, mentally. But you know, it's the brain is very plastic; it can change. So somebody who might be diagnosed with ADHD, you know, that could change over time, and they could develop better impulse control. And there's also non-stimulant medications that you can use. I'm definitely not against medication, not ones that are abusable, but that can really help with things like impulse control or other mental disorders. And then there's also like therapy too that can help somebody. Sometimes people get like misdiagnosed too. So they might like get a ADHD diagnosis or some kind of, once I had like somebody diagnosed with bipolar, he was on all this medication. The family was very set on addressing like the mental illness aspect of it, but lo and behold, like they found that the crack was what was impacting like his mania, and he was in here I think for like 6 months to a year, and he like went off the medication. It was an incorrect diagnosis. So you want to have somebody or the clinician be able to keep them sober long enough to be able to reassess and see if there really is a mental illness. And sometimes there is, don't get me wrong. There definitely is you know, mental illness that has to be treated. But I don't know if that answered your question, did it?
It
okay.
did. But I'm like with the risk taking, like people who cliff jump or like jumping out of a plane, getting that adrenaline rush.
Yeah.
They're just like, I don't want to think about anything else. I don't want to use anything else, or nothing will come close to that.
Yeah.
And then they've associated it with their substance use as well.
So risk-taking behavior in sobriety, or yeah, that's hard, especially for younger guys. Again, I really think that like behavioral interventions can kind of inform that kind of behavior. So if you teach them new behaviors and get them to engage in more behaviors that are reinforcing and that don't have the same consequences that they did out there, I really believe in like consequences can really shape somebody's, you know, behavior. But I don't know, I guess I would need like a specific example. I think that can be part of the therapy, and if they are engaging. Sometimes, often, I know this, I guess this is more anecdotally, but people develop other addictions other than just substances when they come into recovery. So there might be like sex addiction, or they might have like develop a shopping habit or something like that. So being able to kind of address that, and again, address consequences and reinforcers in the environment to change that behavior. And there's 12-step programs in therapy for that as well. But yeah, I hope I answered it. Did
You
I?
did that. Thank you.
Yeah. Anything else? One more? One more question?
Oh, well, I have a question.
Okay. Oh, Maggie, I have one.
Being an alcoholic myself, I have grown children.
Mhm.
And when I say adult children, they're in their early 20s.
Mm-hmm.
And they socially drink. It worries me at times. How do you approach them in a way to where you're not being judged as, well, just because you're an alcoholic doesn't mean that I'm going to turn out to be one.
Right.
But I see the same pattern in their younger years that I had.
Yeah.
So, I mean, is that even something that should be approached?
Yeah, it's a little bit harder because they are grown. So kind of taking some of the suggestions that I put in here will be kind of difficult. But I've seen oftentimes that people who are addicted and have kids that later become addicted, often still, even despite their education and what they went through, they're still engaging in certain behaviors that are enabling. And it's really hard. Like, that is a testament that it is really hard for a parent to watch their kid go through that and not interfere or recognize that their involvement sometimes can be a hindrance and a help. I think providing education and being open and honest about your own experience and the reality, if there is like a long history in your family of addiction, of that kind of reality for them, and also making them aware of the treatment options, and you know, that'll be really helpful. But you're also going to want to not like enable, like if it ever gets to the point where, you know, they want you to bail them out, or, you know, want to stay with you due to them, like, you know, ruining their life or burning it to the ground or losing jobs, that you're kind of aware of that, and then also go to Al-Anon to be able to help you cope with that. But it is difficult when they're older versus like if they're teenagers and engaging in that. But it's difficult. I think doing any of the stuff is really, really hard for any family member. So, yeah.
Thank you.
Uh-huh.
I have a question. You talked
Sure.
a lot about adolescence, but once someone turns 18, their parents can't really force them to go to treatment or do anything about that.
Mm-hmm.
So there's what to look for and then what to do about it. But what about when you have a kid that's 18 that's unwilling to go to treatment?
Mm-hmm.
What are my options then?
Well, oftentimes what we see is parents are still like helping them financially, and there's not like a whole lot of consequences in their behavior that are preventing them from like getting help or accepting help. So it kind of, and I didn't talk a whole lot about like boundary setting, but being able to set boundaries will be important. And usually they're young and they haven't worked that much, and so they can't kind of go on their own and be able to be self-supporting. So providing them options, but not enabling or reinforcing bad behavior, not letting them live with you, or giving them money or things like that. But it's hard. It's a delicate balance. But I think some of the suggestions that were in there can still be prevalent. So calling to check in on them, providing an open line of communication, establishing family dinners, letting them know that there is support and there is family support, you know, if they're willing to get help and find treatment. And also engaging in things like family therapy too can be really, really helpful. Sometimes it's just waiting for the perfect time too. So there's something in their environment that happened. Maybe they got arrested and they spent 2 days in jail. I think eliciting the help of their own friends, if they have friends at school. But it's definitely, you want to have a delicate balance of both being involved in their life and establishing an open line of communication, but then not engaging in ways that are detrimental or enabling. But I don't know if does that answer your question? Or?
Yeah.
Okay.
Thank you.
Yeah. All right. Cool. Oh my God.